Medical professionals of Reddit, what's the worst sex-related injury you've seen at your workplace? I used to work weekend night shifts. Had a younger girl come in one weekend. Despite her age, she had a hip replacement and it was dislocated. ER put it back in and away she went. Next weekend, she's back again. Same thing. Third weekend in a row and there she is. Finally, I ask what she's doing to dislocate her hip and she says her boyfriend keeps bending her leg back to fart during sex. I told her to try different positions. Janitor heated petroleum jelly and injected it into his dick with a syringe. He was trying to make his dick bigger. He added more. Other janitors saw him and decided to do the same. So turns out with nowhere to go, petroleum jelly forms granulomas under the skin, which get infected. Word was the tip of his dick and the base wouldn't get hard anymore, only the middle, and abscesses formed, resulting in what was described as the dick looking like maggots had bored tunnels through it. Janitor 1 was hospitalized for several weeks. As for Janitor 2, he ended up with several ulcerating wounds in his pelvic region. You could stick a finger in them. They were that big. Apparently, injecting your dick with petroleum jelly is fairly common. Some girls have also attempted to inject their boobs, so give themselves implants. It has led to deaths because bits and pieces of it can dislodge and travel to the lungs. Don't do it. Not my story, but my mom's. She used to work in the oncology department of her hospital a while back. One day she comes home, sits me down, and says, "Syphilis in the eye. You always make sure your partner is clean. Don't take their word for it. I don't care what you do. Just syphilis in the eye." That's all I needed to hear. A guy came into the emergency department because his ass hurt after his boyfriend was fisting him. It had torn his bowel. He had to get a colostomy. It wasn't like life-ending or anything, but imagine going to the ER after sex and getting told you're getting a colostomy. A coworker was getting divorced. One night, his soon-to-be ex called about something and she could tell he was having a bad day. So to cheer him up, she told him all about how while she and her new boyfriend were having sex, he shoved a dildo up her ass and it just got sucked up. After failed attempts to remove it, they went to the ER where she got surgery to remove it. After surgery, doctors sanitized the dildo and returned it to her. This story did not make him feel better. Broken penis. Dude's testicles were the size of grapefruits. I assume the internal pudendal artery was pumping blood into them from somewhere. Was a medical assistant then, now in med school. Was a neat injury, but nothing we could do for him in urgent care. He needed surgery for sure. Did see a bottle stuck in a rectum x-ray as well. I'm not one to judge. Keep on freaking on, but don't put glass in your ass please. Dude stuck a pencil up his urethra. Wood is porous. It got stuck. For a day, he couldn't pee around it, and initially that's what his complaint was, urinary retention. Finally, in the exam room when the doc asked him what the hell was with the eraser sticking out of his dick, did the guy fess up. He ended up needing surgery. He was also 70-ish, old enough to know better. My friend works at an ER in a small rural area in Canada. Apparently this young guy comes in and has a can of Axe body spray stuck in his rectum. He was extremely embarrassed and his excuse was that he accidentally sat on it. Typical, not a medical professional, but I had a friend who was a hospital pharmacist. He said a patient came in with a coffee thermos in his ass. Cap first. He got the rest of the thermos out, but the cap stayed. After a couple days, he finally decided to go to the hospital because he couldn't get it out. The cap ended up festering bacteria and he had part of his colon removed. Now that guy is in his 30s with a colostomy bag. Exotic, special ordered venomous spider up the ass. Guy called an ambulance because he wasn't sure if he could put bug bite cream up there too, as the packaging said, for external use only. Lost entire transverse section of necrotic bowel. Lived, but poops in a bag now. My mother worked in an ER and told me a story about a guy who was high on angel dust and couldn't get it up. His friend told him to stick a chicken bone in his dick and he'd be able to have sex. He shoved it in knuckle end first and shredded the head of his dick. Infected penile implant. His dong looked like a purple tall boy beer can. They had to take him to the OR, literally fillet his man parts, take out the implant, and wash it all out. Worst part, they left it open for several days. Ick! Not a doctor, but my friend had a girl go down on him while they were cooking. She apparently had been handling some hot peppers before she decided to pin him to the wall. They didn't go to the hospital, but he swears he was super close to going. Mood was ruined after that. Was working an ER rotation at a major DC hospital while getting my EMT. I wasn't around at the onset, but a gentleman came in complaining about swelling down there, and a nurse gave a cursory look. She immediately took him into a private room, closed the door, and came over to tell us what was going on. The guy apparently liked the feel of weight on his balls when he got off, so he had put his wang and balls through the center of a 5-pound weight plate and gotten off. He then fell asleep. 5 hours later, he woke up, swollen and unable to pull himself out of the weight. He had somehow taken public transportation or walked with a 5-pound weight plate in his pants all the way to the hospital. We spent the next 30 minutes trying to reduce the swelling by putting crushed ice up against him without success. Finally, the charge nurse called DC Femmes to get assistance from the heavy rescue squad to cut through the plate. We took the guy into the psych room, closed the door, and proceeded to cut it off, the entire time having to keep applying more ice to the plate so that it didn't become hot enough to just cauterize his groin. The other patients really didn't appreciate hearing a buzz saw, screaming, and seeing all of the ER staff giggling. Of course, the poor guy also had to deal with a constant stream of doctors or nurses or techs having to go in there to check on something and see what it was all about. This 26-year-old decided to be circumcised. His doctor told him not to have sex. He didn't listen. It peeled like a banana. A young woman came in complaining of pink eye. Looked just like pink-eyed. So we cultured the discharge coming from her eye. Turns out it was chlamydia of the eye. The best was informing the doctor of the results and the puzzling look on the doctor's face, as she wondered how the patient was able to get chlamydia in her eye. Then later the look of disgust on her face as she realized how it happened. Nothing worse than dildos, vibrators, and other objects stuck where the sun don't shine. One chap did say that he likes sticking things up his arse, and that's fair enough. But the strange excuses are usually the most entertaining part of it. Worst genital injury was a guy who drilled his scrotum with a cordless drill doing DIY. Don't secure your workpiece between your knees if you want to be sure to keep both testicles, gentlemen. Back in medical school, I was on a surgery rotation with a classmate. Our first day we got split into groups. By chance, my first case was an appendectomy. By chance, his first case was helping deliver a jewel-encrusted dildo from the rectum of a 250-pound guy. He was at the business end when it crowned and was responsible for catching as the surgeons pushed from above. Mini lava lamp stuck in the rectum. Power cord was sticking out like a tail. Dissected vertebral artery from oral sex, essentially a big brain hemorrhage. Did not end well either. Uncle-in-law had a patient come in that had poured concrete in his own ass while trying to make a custom dildo. They had to chisel the concrete out of his rectum. Wife found out hubby was cheating and slashed at his groin with a knife. Scrotum torn open, degloving one of his testicles. So I have a patient who came in due to a rash on his penis. When asking what may have caused the rash, he states, "I had really rough sex, like really rough." I just nod my head and inform the doctor. We just give each a look of what the hell, and she proceeded to go speak with the patient. The patient told her the true reason why he has a rash, and it was because he dry humped this girl so roughly that he basically gave himself carpet burn on his penis from his pants. A guy who, after hearing his girlfriend had never been with anyone who was uncircumcised, took it upon himself to perform said circumcision with box cutters. He was in the OR within the hour getting the Twinkie put back into the package. Then there was this guy who came to ER with a long English cucumber up his ass. His explanation was, "Don't trust a skanks in an RV."